Hello everyone, hopes all of you are fine. In the previous video, as you people know that we were discussing about subjective examination, and I have told you that there are 5 points that we will discuss in subjective examination, and were discussing about fourth point, that was about special questions. Now in the special questions, the last question that we have asked to the patient is, have recent radiographs been taken, and what tablets are being taken for this and other conditions like osteoporosis from extensive steroid therapy. As you people know that steroid therapy always leads to osteoporosis, so the patient should have taken the medicines of the osteoporosis like calcium and vitamin to reduce the side effects of the steroid therapy. The last point is history. Is in history, we will take from the patient the history of attack of previous attacks of associated symptoms. Are the symptoms worsening or improving? Ask the patient prior treatment and its effect, socioeconomic history as applicable. Now we will discuss about physical examination. In physical examination, we will see observation, brief appraisal, and then we will see distraction in supine position and in prone position. Okay. In physical examination, first of all, we will discuss about observation. In observation, we will observe the patient's posture, his willingness to move head and neck, tenderness. We will check for tenderness or swelling. In brief appraisal, we will first of all check movement, sitting, other joints, quick test, perform quick test of other joints, and move to pain or move to limit. Means F flexion, E extension, LF lateral flexion left, and lateral flexion to right and left. Okay, and in F and E, rotation to left and right, all these movements are performed. Okay, and in F and E, pain, flexion, extension, pain and its behavior, range, countering, protective deformity, localizing, overpressure, intervertebral column, repeated movement and increased speed, all of these things are checked. Okay, now when applicable, sitting, differentiating between upper and lower cervical region, sustained extension, lateral flexion towards pain, to when necessary to reproduce referred pain. Q, upper and lower cervical and sustained if flexion, extension, lateral flexion and rotation are negative. ROTN stands for rotation. Compression in slight lateral flexion towards pain and minimal extension when necessary to reproduce the referred pain. Now we will discuss about distraction. Distraction if flexion, extension, lateral flexion, rotation and Q are negative. Combined movement test we will perform sustained rotation each side and flexion or Q vertebral artery. Other vertebral artery test will be performed. Passive physiological intervertebral movements, cervical rotation and active peripheral joint test. All of these tests and movements are performed. Further we will discuss in next lecture.